This is going to be a video on the active compression test of O'Brien. It is done to detect the SLAP lesion type 2. Before moving on to its procedure, I want to briefly discuss about the SLAP lesion. So SLAP lesion, that is superior labral anterior to posterior tear. It is injury of the glenoid labrum. This glenoid labrum involving the superior glenoid labrum where the long head of bicep tendon gets inserted. The SLAP lesions are divided into 4 types. In type 1, there is degeneration of the superior labrum and the bicep anchor remains intact. So this red portion I have depicted the degeneration. In type 2, there is tear of the superior labrum. So I want you all to keep it in mind that in type 1 there is degeneration, but in type 2 it is rather the tear of the superior labrum. And the bicep anchor, it gets detached from the glenoid rim. In type 3, there is bucket handle tear of the superior labrum. With central portion, it gets displaced into the joint and the bicep anchor remains intact. In type 4, there is bucket handle tear of the superior labrum, but in this case, the tear, it propagates into the bicep tendon itself. So the bicep tendon is partially attached, but it is functionally compromised. Moving back to the O'Brien's test. O'Brien test, it has 2 parts. In first part, as depicted in the diagram, the patient is standing, the examiner is standing behind the patient, and the patient's arm is forwardly flexed to 90 degree and the elbow is fully extended. Then the arm is horizontally adducted around 10 to 15 degree and followed by medial rotation such that the thumb faces downward. After that, examiner applies downward eccentric force to the arm, to which the patient resists. So this completes the first part. After that, the arm is again returned to the starting position, that is forward flexion 90 degree and elbow is fully extended. So here comes the second part. In second part, the shoulder is laterally rotated so that the palm is supinated. Then again the downward eccentric load is applied by the examiner, to which the patient is asked to resist. Moving on to the result, if the pain is on the joint line or there is painful clicking inside the shoulder, not over the AC joint, in position 1, okay, and it is eliminated or decreased in position 2,